bring in Dr. Janette Nesheiwat. She is a physician, Fox News medical contributor, family emergency medical doctor. Good morning to you, Dr. Nesheiwat.
Good morning.
Good morning. So what responsibility does his doctor have? What responsibility does his family have? I remember, when my great-grandmother had Alzheimer's and they said she either needs a nurse living with her or you're going to have to sell the house and put her somewhere. I remember my grandfather got sick. He's not allowed to drive anymore. You're going to have to take the keys. These are tough decisions as a family. But in this situation, we're talking about the President of the United States. He's running our country. And we heard, sorry for a long question, but we heard General Kellogg say when they killed Soleimani, it was in the middle of the night, 2 a.m. So what responsibility does the family have and the doctor have to make some of this information public?
Yeah, you're absolutely right, Ainsley. The health of our presidents is critical to know, and it matters now more than ever because their diseases, their injuries, their illnesses influence the decisions they make and have a direct impact on all of Americans and on a global stage. So they have a responsibility and duty to Americans, right. Number one. And also the family has a responsibility and duty to their father, to their husband, to the president. It's important to diagnose and get it right to determine what does he have and begin the treatment right away. Otherwise, his symptoms, his disease, whatever it is that he's going through can worsen. So you want to diagnose it early so you can begin treatment early, whether it's medications, whether it's physical therapy, whether it's close monitoring. You want to know so that you can begin the treatment and try to stabilize his situation. Sure. I think we're all distracted by the fact that we hear the word Parkinson's specialist that's been visiting the White House. I think that's a distraction from the big picture. Now, what are we seeing? Remember, what are we seeing with President Biden? We're seeing memory loss. We're seeing confusion. We're seeing problems with his movement, slow movement, what we call bradykinesia. We're also seeing problems with his speech and his thinking. Now, could all of that be a part of Parkinson's? It could be. Right. Could it also be maybe Lewy body dementia or vascular dementia or early Alzheimer's disease or just simple cognitive impairment that for some people could be part of normal aging? The problem is we don't know.
Right, exactly.
And how do we find out?
How do we find out? Because if the White House says, yeah, he's got dementia, he's got to stop being president right that second. His personal doctor, Dr. Kevin O'Connor, put out a statement last night because they had to clarify, because it was so puzzling what KJP was saying yesterday at the briefing. They put out this clarification, which is still kind of broad. Dr. Nesheiwat, they said Dr. Kennard, that's the neurologist, was the neurological specialist who examined President Biden for each of his annual physicals. His findings have been made public each time I have released the results of the president's annual physical. President Biden has not seen a neurologist outside of his annual physical. So, in other words, he's been president 3.5 years. He's had 3 physicals. He saw a neurologist as part of the physical. But, Dr. Nesheiwat, don't you think, isn't it malpractice for his personal doctor to see that performance and not say, hey, maybe we should do some other tests?
Yeah, I think they are doing them, but they're withholding that information. So what I would do if I had a patient that is presenting like the president is, number one, I would repeat an examination. 6 months ago was his last exam. That's a long time for an 81-year-old. A lot could happen in a 6-month period. So the first thing that he would need, what I would do for my patients, is a complete physical, mental, and neurological examination, which includes a mini mental status examination. And then I would consider some simple blood work to check for maybe hormone deficiency, thyroid deficiency, vitamin or mineral deficiency, or maybe another type of disease like Wilson's disease, which could be, an excess of copper, for example. And then we need to consider imaging. There are some specialized imaging brain scans that check for dopamine activity or maybe signs of a stroke or a tumor or infection. There are tests that can be done, and he is the president of the United States, and he has full access to all of these tests. Exactly. I think they are being conducted, but that information is being withheld, and I think it's a duty to share that information with America because we have an election coming up, and we want to choose someone that is strong, that is a good leader, that is coherent, and that can make the right decisions for us and our country.
Doc, it's such a good point. We also have a country right now, and we need a president that's up for the job. And I get the impression from the White House that they're much like lawyers speak, they're giving us doctor speak. The stuff that average Americans, we don't understand. That they're speaking in cryptic language, and it just appears like they're evading real answers to us, and I don't like it at all. Doc, thanks so much for joining the program.
Thank you, guys. Have a great day.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.